If we look across our wider region, more than 100,000 people are living with frailty. If we wait for them to become unwell and then have to treat them in hospital, often it's too late. What we want to be able to do is intervene a lot earlier. And this is where the neighbourhood health model comes in.
In acute hospitals, we should be keeping them for patients who need to have emergency care or emergency surgery or something such as a stroke or something cardiac related that can't be dealt with necessarily in a community setting. Everything else should be able to be treated close to home. You should be able to leave your home, have a short distance to get to the community centre and receive the same outstanding care that you would receive in a hospital setting. But you don't need to be admitted. You don't need to be in a bed. You don't need to wait for a long line of people or to get an appointment, because this is going to be something that's going to be easily accessed, have lots of appointments, and people will be able to get the care quicker.
Hospitals are amazing. They do great things, but we know that for lots of people, actually going to hospital isn't the right thing to do. The community teams that we run are experts in looking after people in their own homes and outside of hospital environments. We know that lots of people spend a lot of their time organising their diaries. They go to one hospital one day to see one specialist, a different hospital, a different day of the week to see another one. And it's really disruptive for people. By bringing all the services together in one place, it makes things so much better for patients.
Neighbourhood care really is about care being designed around the patient rather than being designed around the hospital or the doctor. One key part is virtual hospital. This is where we can look after someone and give them hospital level care at their own home rather than bringing them into hospital, and get them out of hospital earlier back into their own home using the virtual hospital approach. Over 9 out of 10 patients, when asked the question, are very clear that they, if possible, they would rather be looked after in their own home than in hospital.
Ultimately, what we're trying to do is to bring care nearer to people's homes, near where they live, ensure that care is being done in the right place at the right time for the people in Dacorum, so that we can promote them living longer, healthier, and independent for as long as possible.